Hi, I'm Dr. Michael Drabkin, Chief of Interventional Radiology here at New York Imaging. During most of my training, we used femoral access for embolization cases, but as I got out there on my own in practice, I really love using Radial, and I've now fully switched over to radial access. It makes the procedures easier, faster, the recovery's better, patients like it more. I'm able to stand further away from the beam when I do the procedures, reduce the radiation dose to myself. Generally, I have patients recover for just 2 hours. With femoral, sometimes if we weren't able to use a closure device, it could be 4 hours or more in recovery. Much lower incidence of site complications. Even a very skinny patient might have the risk of having bleeding into the soft tissues in the groin, but even a very big patient usually will have a skinny wrist and you'll be able to get good control of any possible bleeding. I also find the angles to be really favorable for doing pelvic cases in particular. UFE and prostate, very easy, no need to make a loop, no worry about torquing yourself out because you just dip down right in, use the Rabi catheters, and really makes a big difference in my cases. I also really like taking advantage of the glide sheath slender. So it allows me to feel comfortable and not worry about shutting down the artery, even in patients who don't have particularly plump radial arteries. One of the great things about radial access is it really allows me to do the kind of volume that I need to do in an outpatient center. So, my patients get their UFE, they get their prostate artery embolization, and, they recover in less than 2 hours. I don't have to worry that I have a patient recovering for 4 hours or more after a groin stick if I couldn't do a closure device. I can have them recover in chairs rather than laying flat if I need to, and it just really gives us a lot of flexibility.